Hi, good morning. Hard to believe it's 3 months since the last time I sat here and we shot one of these videos. Um, well, incredibly, summer's gone by. It's a couple of days before the kids head back to school. We had lots of Canada geese out here this morning, getting ready to head south. Unfortunately, I think they're going to be the only Canadians heading south this winter. Um, In reflection, it's been a gorgeous summer. Things have gone really well in the office. We tweaked and changed things a little bit once we got going. But in general, the practices are both running really, really well. And the staff have helped us change and tweak some of how we do things just to make it a little more streamlined. And feedback from our patients seems that they're confident and happy coming in and they feel like they're being well looked after. So again, obviously there's a lot of trepidation about what's going to happen in the fall. Um, Talk about second rounds of the influenza virus, flu, the season, things like that. And it's important, I think. What we're doing at the moment is working, and we're going to continue to do what we're doing to look after you. And we're going to continue to ask you to do the same diligent social distancing, mask wearing, hand washing, everything that's been working up to now. We're going to keep that going until such times we get a vaccination that can be delivered to hopefully the vast majority of the population, and we can then return to normal. It's interesting, I was reading the other day from Australia. They're in the midst of their flu season. And this time last year, Australia would have expected to see somewhere in the region of 340 deaths, unfortunately, due to the influenza virus. This year, they've had 34. Whilst any is too many, that's an incredible difference. So whilst the COVID virus is not the same as the influenza virus, it is still airborne. And clearly the measures that they've undertaken there to maintain public safety is working. It's working spectacularly well. And hopefully we'll continue to learn from this. And maybe in the future, when this is all gone by, when we have a bad influenza virus outbreak, we'll apply the same rules again just to get us through that short period of time and minimize the effects. So we will continue to change things. We're going to have to hire a new office manager for the Mississauga office. We may even need extra staff in Brantford in the future because that office is very busy at the moment. We can't, again, unfortunately, have Marilyn and I working together just because we're trying to keep the numbers of people and traffic in the office to an acceptable level where we're not adding to cross-infection. So as soon as we do get extra staff hired, then we can go back to expanding our hours even further. And again, thank you to our staff for helping us through this, because without them, we wouldn't be doing it. So please be patient with us, be patient with them, and continue to look after each other, be healthy, and continue to practice everything you've done up to now. Thanks. We'll see you back in the office very soon.